Hi, and welcome. My name is Tyler Orn, and we are back in conversation with well-respected trauma practitioner Michele Smith. Michele has her advanced level trauma and resilience practitioner certification, graduate certification in complex trauma at the master's level, some graduate studies in pastoral care and counseling, and 24 years experience with survivors of traumatic death of a loved one. Michele is the founder and president of the Aaron Society, Focus on Trauma, a non-for-profit that offers peer support and education in trauma and post-traumatic stress disorder. This is not-for-profit is Michele's way of giving back to the community. She also does some private practice in the city of Victoria and surrounding districts. Welcome back, Michele. It's so nice to see you again.
Hi, nice to see you, Tyler.
Yeah,
In a little bit. You're looking well.
it has been. Last time, we talked a little bit about the traumatic experience in children, specifically in terms of our societal lockdowns. We discussed certain key trauma symptoms occurring in children today and stated we would continue our conversation next time to take a look at what our children may be experiencing as they go back to school. So let's do that.
Okay, well,
Given that our society remains in a general lockdown, and this is being extended to our schools, what sorts of impacts from your perspective might the lockdown experiences have on children as they return to school?
Okay, well, as you know, Tyler, I'm really extremely worried about children during all of this, and so let me start with belonging, which is, of course, one of the universal needs of all human beings. From birth to death is having a sense of belonging. Isolation can lead to shyness and worry, fear, or lack of trust when trying to reintegrate back into socialization, and that can happen even with the most confident of children. And so for many, they've had the ability to engage in things that to give them a sense of accomplishment and mastery taken away from them, and that can be as simple as a preschooler learning their or mastering their colors and numbers. So limited goals and support to reach potential can cause confidence and self-worth to diminish. And children reluctant to take risks and learn new things. They may have experienced no control or power or choice. And that's a biggie. Uncertainty of what is going to happen next is a big one for them, and not being able to go outside and move around without permission, leaving them feeling helpless and feeling like victims. Fear can leave them hypervigilant. We talked about that one before, and limiting their ability to connect to others with empathy and so on. So some children may have experience crisis on top of crisis. So it may not just be one. So others may not feel as traumatized and express a different experience of the situation. But we need to keep in mind that COVID is a multi-tiered crisis situation. So it's global, and according to officials, it's a public health crisis, it's a political crisis, it's an economic crisis, it's rapidly becoming a drug overdose and suicide crisis. It has been prolonged and exaggerated. The end is unpredictable and uncertain. So it's a mental health crisis. We are not talking about a limited one event crisis. So I've been told by some in the education system that children as young as kindergarten are displaying evidence of trauma, and that was before COVID.
Before?
Yeah.
Wow. Okay. I remember from our last video that you mentioned that this whole episode in history seems to be a tsunami of trauma, and that sounds like what you're talking about with the layers and it going on and on with no end in sight. That's tremendously damaging. As children re-enter the school system, then we are seeing different degrees and different types of health mandates. This seems to depend on the particular region, province, district, city. But in general, what concerns do you have, if any, are you perceiving with some of those school mandates?
Well, as we've discussed in some of the previous videos, the psychological effects of social distancing and isolation are having very negative consequences,
Mm,
ensuring that fear is reinforced and everyone, including other kids, are the enemy, and a threat is just more of the same. So instead of the relief of going back to school with friends and perhaps familiar faces of teachers and routine and a level of safety, they have walked into an extension of what they've been experiencing with visual reminders absolutely everywhere. Um, Now, having said that, there are also a lot of schools with a lot more relaxed mandates, and outside of this, um, even with the relaxed mandates, that's still there constantly. And so,
mm,
um, outside of that, I have probably three major concerns where the kids are actually concerned.
okay.
Masks, we discussed before, were discussed in my previous videos, and even though children in BC are not required to wear them in the classroom, they're still required to wear them in the hallways, bathrooms, and on buses. So one child told me that before entering the hallway at school, the teacher would say, "Everybody mask up." So we still have constant reminder of threat to safety.
Mm,
Teachers wearing masks poses a whole other challenge. Masks are covering the identity, as I stated before. So the mask and what it represents is the prominent visual entity when children are viewing people with masks. And children in homes that are unstable or a child in distress may be a lot less likely to seek help from someone wearing a mask that represents a threat to safety.
mm,
So the likelihood this will hamper the ability to trust and connect is a high one, and could contribute to the child feeling even more isolated than they did before. The second concern, and I am trying to, I'm probably just scratching the surface here, but the second concern for children is that I had the opportunity to sit in on an online educational seminar that was actually really generated towards teachers and educators to help them prepare for children returning to school.
okay.
I was a little upset, I think, to find that they were advocating little books and catchphrases like "We wear because we care" and other tools that were actually geared, in my view, towards the propagating of children into believing that all of these mandates were altruistic in virtue,
Mm,
because they were
okay.
taking care of grandma's health. I mean, that wasn't exactly what they said. That was the general idea. Um, this could very easily prevent children from expressing their struggles and their fears. It also has the potential of throwing guilt and internal conflict into the mix. Firstly, I'm not of the opinion that children should be made in any way, shape, or form to feel responsible or accountable for someone else's health, or be made to feel that they themselves are walking disease bombs ready to go off in any given moment and kill someone else.
Mm,
Um, so it is okay for the children to say they're worried and afraid. And it's our job to make them understand that their feelings are absolutely normal given the circumstance, and to help them find resilience, power, safety, and purpose and belonging despite those
mhm,
circumstances. So it's our job as adults to make them feel safe and taken care of, not the other way around.
mhm,
Children aren't responsible for the life and death of other people. So they're children, and we should be calming those fears, not feeding them. And I don't know where we ever got to the place. Honestly, Tyler, I don't know where we ever got to the place that we thought it was okay to feed the fears of children in this way. So with social distancing, children being both physically and psychologically conditioned to avoid sources of safety and comfort instead of running to them, and turning others into a potential threat, isolating them even further. So the
wow.
third concern is one that I'm going to be very, very brief about, but it is something that rattles me a little bit. It is the testing that's been made readily available for children. I have now run into two cases of children being sent home, one from daycare and the other one from school, one for a very low grade fever and the other one for sniffles. So certainly not uncommon for children, and but they were not allowed to return until they'd been tested. So with smaller children, they cannot understand to do the swish and spit, so they're going to be restrained and a swab inserted in the sinuses for roughly 15 seconds. This can be, I know, this can be incredibly traumatizing for children. So it reconfirms also the fears associated with the virus. The children are not, really at high risk for, and certainly not at high risk of death. So there are also problems, according to some new reports, with the PCR testing itself and producing a minimum of 50% of false positives. This was also brought up in a government cabinet meeting. So there are many doctors out there who have come out to say that the testing is flawed. Dr. Mike Eden, for example, is an allergy and respiratory therapeutic expert, developed out of a knowledge of biology and therapeutics, and is an innovative drug discoverer with over 25 years of experience in drug discovery and development. And Dr. Eden has published over 40 original research articles, and since 2011 has consulted to more than 20 biotechnology companies. Prior to consulting as an independent, he was vice president and chief scientific officer of the A&R research unit at Pfizer. So he has stated, he's a scientist, so he has stated in Lies, Damn Lies, and Health Statistics, the deadly danger of false positives. So he said, we now know that lockdown made no difference at all to the spread of the virus. We can tell this because the interval between catching the virus and in those who don't make it, their death is longer than the interval between lockdown and peak daily deaths. And he said there isn't any controversy about that fact. It's easily demonstrated, but I'm aware some people like to pretend it was lockdown that turned the pandemic, perhaps to justify the extraordinary price we have all had to pay to do it. Then he goes on to say that the PCR test is fatally flawed and must immediately be withdrawn and never used again in this setting unless shown to be fixed. He said the test cannot distinguish between a living virus and a short strand of RNA from a virus which broke into pieces weeks or months ago. Well, when you're talking about children in particular who catch colds and flus and all kinds of stuff, we have these tests readily available for children. So as if they are as if what they're experiencing is not traumatizing enough. I'm going to leave this one here because I'm not of the opinion that children should be frightened to death of every cold, cough, or sneeze, and also of other children. Tyler, I wish I could say more in terms of the scientific evidence, but I really can only quote those that know. But I do have some deep concerns about the testing, the readily testing availability for children.
Yeah, for sure.
So, did you have a question in there, Tyler? You looked concerned.
I do.
Go ahead.
I raised an eyebrow at a couple points, and I wanted to go back to them very quickly.
Fire away.
So, if I hear you correctly, we're subjecting our children to the type of testing that is quite potentially traumatic for them, and yet we are only getting at best 50% accuracy. Well, that means, right? That means that 50% are accurate. The other 50% are not accurate. And so it's really a coin flip on whether the test is effective. Is that, am I hearing that correct?
That's what they're saying. Yeah, that's what the experts are saying. Yeah, that's
so we're subjecting our children to something that is a coin flip, whether it's working or not.
Right. In the Canadian cabinet, this was this whole problem with the testing was actually presented, I believe it was, to the health minister, and she said, "We know." And he said, "What do you, this is producing at least 50% false positives. Really, we can't drive a lockdown based on that." And her response was, "Yes, we know, but what would you suggest we do? Stop testing?" Well, in my mind, the answer to that would be, yeah,
Yeah,
that.
that makes
You know,
logically, if,
yeah.
anyways, okay. The
So
second,
that's sort of, yeah. So yeah,
yeah, that makes sense to me.
yeah.
The second point that really hit me there as you were talking was that there are people now and one that you quoted in particular, that are saying that scientifically the lockdown that we have been under, and especially and again in the context of our kids and what is happening and what the lockdown is doing to our kids psychologically, emotionally, spiritually, mentally,
Right.
that the lockdown is not effective. It was not effective in stopping the spread of COVID. So why would the responses then be, well, what else are we going to do?
Well, that's a really good question. That's a really good question. You know, because just if you're thinking of that, Tyler, just on in just anyone who has a thinking brain, have we stopped the common cold? Have we stopped influenzas? Have we stopped other respiratory viruses that are passed on from one human to? Have we stopped any of that from happening?
No,
Perhaps
not at all.
no. And so lock down all you want. Perhaps this is going to, as they're suggesting, simply be a virus we're going to have to learn to live with. And the good news about this is that our death rate is going down, and hospitals are getting, and medical professionals are getting more and more adept at dealing with this. So we have some good news happening here. So the more they learn about it, the more they're we're seeing a lot of better things being done. So perhaps it's just that if you're looking at the incredibly astronomically high recovery rate of this, and then say, well, you know what, this may be a virus, just like other viruses, that we're all going to have to live with. Well, you know, they're doing some very good things in the medical field with it. But as for cures, I don't know. We've got a flu vaccine that hasn't stopped the flu. So
No, not
but
close.
no. So just thinking about that, I think would be enough to tell someone, lock down all you like. We're talking a virus here.
Yeah.
You know? And
Okay.
as one gentleman said, he said, in order to stop, to prevent a spread of a bug, you would have to lock down absolutely everyone permanently. And he said that is not conducive to life.
No. And
And
it's not realistic.
no, absolutely not. No. So yeah. So those are. Those are some of the major concerns that I have, and as I say, I'm going to leave that third one with you because and I know that I can tell you've got another question sitting there on your tongue, so I'm going to let you have that one.
Thank you. Actually, it's just a continuation in some ways. The points that you bring up, they're very valid. There's a lot of really good food for thought in that. And it's because we're talking more about the schools. Let's talk about the teachers
Okay.
and let's ask the question, what about the teachers and what role do they play in this? So from what what you're seeing and what you're hearing, what are some of the things that have stood out for you regarding the teachers?
Actually, I have a bit of a different take on that, actually, Tyler. I am actually quite worried for teachers.
Hmm.
I have raised 5 children in the public school system, so I've certainly met some bad teachers, but I've had the experience also of meeting some really, really good ones. And quite a number of years ago, let me just give you a little bit of history so you know why I would be, because there's a lot of people that really aren't aware of this, that having been in that system at that time, quite a number of years ago, children with alternate learning styles, and they now call it disabilities. I refuse to call it learning disability, so that's what I call it. So children with alternate learning styles that were all integrated into the main school system. And this was done with the promise of support to meet the needs. So that support, but that support never materialized. So that was not just funding, it was appropriately trained teachers and everything to deal with this situation. So a teacher with 30 students may have as many as 10 or 15 children with individual education plans that they not only do not have time to read, it is virtually an impossibility to implement them. So this has been incredibly harmful, not only to the teachers, but to the children as well. Because it not only did that support not materialize for them, and so they didn't get the help. So teachers and parents of these children were well aware that their children were not getting an appropriate education, and in many cases were struggling and left to fend for themselves. Those that could afford to found themselves hiring tutors and paying on top of their taxes for their children's education, despite the fact that they were promised an appropriate education for their children. So those that couldn't afford to hire tutors, well, those kids by and large wound up being left to struggle within the mainstream school system. So when the teachers tried to strike for smaller classroom sizes and for qualified teachers, for those alternate learners, they were spit on, yelled at, accused of being lazy. They were advocating for our children and their right to an appropriate education. So many of those that did those things didn't really care at all for those that needed the extra help, nor did they care what their own children were learning. They cared that their free daycare was taken from them. And fortunately, that wasn't all parents. We had some very good parents out there. So on top of that, under the Liberal government for 13 years, they continually had funding pulled all the time. So it was an absolutely impossible situation for them. But I wanted to read you something because it was sent to me, and I thought this was incredibly interesting. That came to my attention not long ago in regards to the COVID issue. So what had happened was there was the NFL had posted, of course, that an article that the NFL players were opting out. Okay, so they were opting out because of COVID. Well, here's what the public, here's some of the public's responses to the NFL players opting out. They said it's a great example to set for the country about how to cope with COVID and prioritizing the health of your family. Kudos to them. Another one said, they put their bodies at risk. That's one thing. But the NFL is asking them to put their family's health at risk. Family before anything. Another one says, stay safe, young man. People are going to hate regardless. Somebody else says, glad to see common sense. Love my Patriot players and support their decisions. Nothing is more important than their health and the health of their families. And then the last one said, gentlemen, take care of you and yours first. We will take care of the rest. Okay, so that was his response they got.
Sounds okay. That sounds good.
Yeah. Okay. So now here are the comments to an article about teachers advocating for the safety of themselves and their students. Now, remember, the teachers are not opting out. Okay. School was coming back in. There was a lot of fears associated. There was a lot of stuff still unknown, and there were at-risk teachers, with asthma and so on. So they were advocating for, smaller classroom sizes where they can make social distancing happen and so on. So here's what happened. Here's how the public responded to teachers advocating for safety for themselves and their students. Good, quit already. Tired of all the gutless threats by worthless teachers. Do your job, teachers. You had the summer off and part of the school year off. Pretty sure you didn't stay in during the height of all of this when the kids were serving you at the grocery stores and fast food places. No entitlements for those teachers refusing to work. What about wussies? Cut their pay off. Bet teachers everywhere shut up. call her bluff. She just wants a free paycheck to stay home. And the last one, teachers don't want to work the 3-month paid vacation they get every year. Ain't enough, bring in the substitutes. Well, I just want to set the record straight on something. Teachers do not get paid during the summer months. I would really appreciate it if people would stop saying that. They do not get paid during the summer months. Teachers do not write the curriculum. This is quite a difference in those responses.
Yeah, there seems to be quite a double standard in what's said.
Yeah, and I guess I would have to ask, what have the NFL players done for you recently? I'm sorry, this is, quite shocking. They don't write the curriculum. They are given what to teach and basically told, teach it or you don't have a job. So you would be surprised actually at how many teachers may agree with you on things being taught in the school that they don't agree with either. So if parents are going to confront curriculums, you need to set your sights a lot higher than those teachers. Okay, so teachers were exhausted before the school year started this year. Health mandates were changing daily as they were trying to get ready for the kids' return. Classroom sizes were not reduced as they had expected. They also had been driven with fear by media and concern for themselves and their families. And there are a number of teachers who have asthma, respiratory conditions, and are at risk themselves. So they had to try to accommodate the children, differences of opinion, and sometimes outrageous demands of fearful parents and an ever-changing health mandates. So they also, are experiencing a significant increase in behavioral issues due to lockdown, social distancing, and trauma in children. And some of those behavior problems have come from students who never exhibited behavior problems before. So by the first week, they already felt as if they'd worked 4 months. We often talk of first responders and the need for intervention for vicarious trauma. In my view, teachers are at the very top of the list for risk, not only for personal trauma, but for vicarious trauma as well.
Yeah, I can see that for sure.
Yeah.
And now, given that, with that propensity, what kind of supports are being given to teachers to help them recognize, understand, and actively support kids in their classrooms that are expressing trauma symptoms? Is there anything?
I'm sorry, could you rephrase that, Tyler? I didn't quite get.
So with with what you have said about the kids expressing the symptoms, are there supports being given to the teachers to help them recognize, understand, and actively support the kids who are experiencing those traumatic symptoms? Is there any support being given to the teachers to help them with this?
Yeah, that's an interesting question. Now, I can only tell you on the little bits I've been able to glean in here that in some schools there have been some extra staffing. School counselors are overwhelmed. I just like it. I feel so sorry for them. You have no idea. People think that this is groups of children. These are traumatized children, and some of the issues that these counselors are dealing with are huge. And all of this depends on the area and the school itself, and how that school functions and operates. So. I'm not sure what every school has or whether those are appropriate enough, but I honestly feel, my feeling is that it is time for systems to start, because there's never enough. It's time for systems to start reaching out to what's available in the community as well. And kind of saying, can you come in and help? We can't just have, we need to do everything that we can for those children.
It's about the children.
Yeah. So reach out, reach out. And so that's my feeling on it. So what exactly is going on in individual schools? I did hear from one school, and they had put some additional staffing in and so on. Now, whether that additional, which is great, but I mean, whether that additional support is adequate enough, that is quite another question.
Okay. Yeah, absolutely. And how do we determine that? Well, that's another question for, I think, another day.
It is, yeah.
Now, I know it's not your intent to voice as much what to do exactly as to ensure that both sides are being seen in this, so that appropriate decisions can be made. And so you've been letting us know what's been happening at the schools and what's happening with the teachers and how they're apparently functioning and not functioning. And from, in your opinion, what needs to happen right now? What would you like to see?
Well, actually, there's a couple of things I'd like to see, Tyler. As you know, I am exceedingly worried about children during this whole thing. And I, counselors, psychologists, and so on, clinical counselors, people have stepped forward like by the dozens to warn about this, to warn about the traumatic effects on children. And I have repeatedly, you and I have done this together. I've repeatedly showed the correlation,
Mm-hmm.
and expressed my concerns and said there's going to be deep repercussions. They've been warned 10 years, 20 years, 30 years, and more. They have been warned and warned and warned, and our children, I think, are going to are suffering the bulk of this. And I have a deep concern that it doesn't appear that anyone's listening.
Mm.
So and this is feeding also. If you go downtown, you'll see the odd parent. It's not, again, it's not all, but in one case, a woman with two very tiny tykes in the store, both masked up, and as little tykes will be, they're trying to touch, and
Of
this mother,
course.
yeah, exactly. Well, this mother screaming, "Don't touch COVID! Don't touch COVID!"
Mm.
And I listened to this all the way. Well, it doesn't seem to occur to anybody that may be a person who could use some assistance with fear that may be irrational and out of control, and certainly passing that on to children I mean, we don't realize, I think, when we're trying to protect our children, but we're doing it out of a traumatic response, that we're actually passing trauma on, not
Yeah,
so that's the first
absolutely.
thing. And I would like to see parents in the community get together, ask for a meeting with the teachers and in their
Yeah.
children's school, and eh, and tell them, we know, you're under strain. We know you're tired. We know you've got your hands full. Explain to them that you want to hear what they need, because you're wanting to help in any way you can for the sake of the kids, and ask how you can help. I think this gives community their power back and brings
Mm.
them together for the sake of the children, which is, I love to see communities take their power back. Uh, so if necessary, speak to people who may know and be able to present all of the issues, uh, uh, and then together be able to make some decisions about going forward, um, without jeopardizing the emotional, mental, and psychological health of the children. So also discuss options for keeping your at-risk teachers safe. It doesn't really matter whether someone agrees with the fears or not. It needs to be addressed. There are many ways that can be looked at that don't cause children to see it as a threat, but it still takes into consideration the health of particular teachers. So I have great faith in the power of communities when they come together with empathy and compassion and with a common focus. So they're a force to be reckoned with when they're standing strong together and supporting each other and listening to their own counsel. They just need to ensure that in the current climate, that the decisions are cognitive and are not driven by those that are fear driven themselves, because that can happen. So we may not always agree with a particular teacher, and that's okay. That can be addressed. Accountability is very important, of course, but as long as there is division, we're also contributing to an unsettled environment for the children, and
Mm.
it weakens our ground. And so the key is together making them feel safe and secure, and that will require some give and take and 100% focus on the kids themselves. Our children should not be raised up in an atmosphere of fear and trauma, and conditioned to avoid the very people who offer them normalcy, health, and safety. This will have some dire consequences down the road on a
Mm.
whole generation of children. I cannot even begin to stress that enough. So communities, you know, step up and
Yeah.
take control of the situation.
So I hear you saying two things. One, that we need to work together on this. This isn't something that's going to happen in isolation, which is kind of the exact opposite of what has been
Right.
happening.
Yes.
And the second thing I hear you saying, you said a statement that trauma reactions transfer to our kids. So
Yeah.
if we respond out of fear and respond, even if it's something that seems on the surface to be a good thing, if the motivation is fear-based,
Right.
that fear transfers to our kids and perpetuates the trauma.
Exactly. Exactly.
So
It's got to stop, Ty.
yeah,
It has got to
so
stop.
that yeah, okay. So that's an important point that I think that we need to remember, and it behooves all of us then to examine what's our motivation. How are we responding in the moment and long term to what is around us?
Well, and are we, and that's a really good point, Tyler, because somebody just told me of actually, I was talking directly to the person in the bank who told me of a lady who had not left her home. This was the second time since March, and she came in.
Wow.
Yeah, she came in to pay her bills, and somebody walked into the bank without a mask, and she literally was so terrified she flew out of there without completing the transaction. And I said, "So what?" I asked him. So I said, "What would you think you would be the response?" He said, "Well, we better make masks mandatory for everybody." And I said, "Wrong response, in my opinion." I said, "What you're doing is making everyone accountable for someone's fears. Those are very extreme fears. And has it ever occurred to anyone that maybe that lady needs some help?"
Yeah.
So reinforcing those
Yeah.
fears is not a good idea. And
Yeah.
so why do we keep doing this kind of stuff?
Yeah.
Reinforcing in children is a horrible thing to do.
Yeah. Yeah. And again, it makes sense.
Yeah.
It's just that we seem, as we referred to last time, we seem to, in our fear, not be able to extend logic.
Right. That's the problem, and is that they think they're doing the right thing because this is a reaction,
Yeah.
and they believe they're doing the right thing because
Yeah.
it hasn't. If they ever get over it and look back, they won't. But
If
yeah,
hindsight is 20/20, as they say. So
exactly.
okay. Um, Michelle, thank you so much for offering your perspective. Are you doing any online work at this time?
I do a little online work. Yes, it is always my preference to work with people in person. That is a
Sure,
better way
that
of
makes
doing it.
sense.
But sometimes that's not always possible. So I do a little online work. Yeah.
Okay. So if anybody wants to connect with Michelle regarding this topic or any other ones that have been presented, or wants to talk with her about their own situation, please feel free to do so. Again, her websites are traumapractitioner.com, all one word, and Aaron's Society Focus on Trauma.com, all one word. And Michelle, we're hoping that you'll be able to be available to come and speak again on another topic regarding trauma and the effects of trauma
My
in the near future.
would love
So
to.
that is wonderful. Thank you so much for your time. And we thank all of you and look forward to seeing you again.
It
Take
was
care.
great to see you, Tyler. Thank you.
Yes, thank you, Michelle. Take care.
Bye.